Hook. The dog hit the floor like a body dropped from height. 110 pounds of military-trained muscle folding at the knees, a low, guttural sound tearing from somewhere deep in his chest. Not a bark, not a whimper. Something worse. The kind of sound that made grown adults step backward without thinking about it first. The emergency room at Hargrove Regional Medical Center went quiet in the way emergency rooms almost never do. A man in a worn army jacket was on his knees beside the animal, one hand pressed flat against the dog's side, his jaw locked so tight you could see the muscle working beneath the skin. He wasn't crying. He looked past crying. He looked like someone who had already survived things that would have broken most people, and was now watching one of those things happen again, right here under fluorescent lights, on a Tuesday night in Delwood, Wyoming. Nobody moved toward them, and then one nurse did. Before we go any further, if you're the kind of person who stays until the end of a story, this one's for you. Follow along, hit like, and drop your city in the comments. I want to see how far this story travels. Let's go. Bam. The shift had started the way most of Olivia Marsh's shifts started, badly and without warning. She'd clocked in at 7:15, 15 minutes late, because the parking structure had an elevator out, and she'd taken the stairs wrong and ended up on the sub-basement level where it smelled like standing water and old pipe. Her scrubs were the pale green ones she'd washed too many times, the ones that had gone thin at the left knee. Her badge was crooked. She'd forgotten her good pen at home and had to borrow one from the supply closet, a stubby thing with a cracked grip that left a mark on her finger when she wrote. None of that was unusual. What was unusual was the look Supervisor Karen Pruitt gave her when she walked through the ER entrance, a look Olivia had learned to read over 8 months at Hargrove Regional. It wasn't the look of someone who was annoyed you were late. It was the look of someone who had already made a decision about you and was waiting for you to confirm it. "You're on triage assist tonight," Pruitt said, not looking up from the station tablet. "Bed 3's backed up. Dr. Albright wants cultures run before 9. Don't make me remind you twice." "Got it," Olivia said. She didn't argue. She'd learned that arguing with Pruitt was like trying to reason with weather. It didn't change anything, and it left you wet. Hargrove Regional was not a bad hospital. That was the thing nobody told you when you took a job in a mid-sized city ER. The hospital didn't have to be bad for the work to be brutal. Delwood, Wyoming had 43,000 people, one Walmart, 2 competing funeral homes, and a hospital that served a geographic footprint so wide that sometimes patients arrived who'd been in a car an hour and a half. The ER saw everything from black ice accidents on the interstate to frostbite cases in January to, once, a man who'd walked in holding a fishhook through his palm with the calm of someone who'd simply come to return something borrowed. Olivia had been a nurse there for 8 months, probationary period. The kind of employment status that meant you did your job without complaint and hoped the people above you noticed, and when they didn't, you kept doing it anyway. She was 28 years old. She had a small apartment 12 minutes from the hospital, a plant she kept forgetting to water, and a set of habits that struck her coworkers as slightly odd. The way she automatically scanned exits when she entered a room, the way she ate fast and without apparent enjoyment, the way she never seemed rattled by the things that rattled other people, and then seemed occasionally rattled by things that shouldn't have mattered at all, like loud sounds from the parking structure or a helicopter passing too low overhead. Her coworkers had theories about her. They shared them in the break room in the way people share gossip about someone they find slightly unreadable. Quiet, private, keeps to herself, hard to get to know, probably has a story. Nobody had asked her what the story was, and she hadn't volunteered it. That was the point. She moved through the first 2 hours of the shift the way she always did, efficiently, without drama, doing the job in front of her, and not borrowing trouble from the job that came after. She ran the cultures for Dr. Albright. She checked in on a 62-year-old woman in bed 3 who had come in with chest pressure and was now watching a cooking competition on the small mounted television with the volume turned low. She helped a tech restock the supply cart in the trauma bay. She drank half a cup of coffee that had gone cold without noticing it had gone cold. At 9:40, the automatic doors slid open and everything changed. She heard it before she saw it. Not the man, not the dog. The sound. That low rattling exhalation, something between a growl and a moan, that she recognized in the way you recognize something you haven't heard in years but never actually forgot. It was the sound of an animal in significant pain trying to hold itself together through discipline alone and losing. Olivia looked up from the chart she was annotating. The man coming through the door was somewhere in his mid-30s, medium height, the kind of build that came from actual labor rather than a gym. He had a prosthetic left hand, a functional hook-style model, not a cosmetic prosthesis, and he was using it to brace the dog against his right side as he moved, half carrying the animal, his jaw locked, and his eyes scanning the room with the rapid assessing quality of someone accustomed to scanning rooms and finding threats. His jacket was army, not a costume. The wear on it was real. The patches were the kind that didn't lie. The dog was a German shepherd, dark-saddled, large-framed. Military working dog physique, the broader chest, the different carriage. He was trying to walk and failing, his left rear leg dragging at an angle that made Olivia's chest tighten. Even hurt, even in obvious distress, he was scanning. The head moved, the ears swiveled, training so deep it ran even through pain. The man got to the reception desk. Pruitt was there, along with Dara Voss, the charge nurse on tonight, and two registration clerks who had both already taken a step back from the counter. "I need help," the man said. His voice was controlled, precise. Someone who had learned to communicate under conditions that didn't permit shouting. "His name is Bravo. He took impact on his left rear. I think the hip joint. He needs imaging and pain management, and he needs it now." Pruitt looked at the dog, then at the man, then at the dog again. "Sir," she said, "this is a human emergency room." "I understand that. We don't treat animals here." The man's jaw tightened. "He's not an animal. He's a military working dog. He has an active service record. There has to be someone—" "There's a veterinary emergency clinic on Route 9, Pruitt said. 40 minutes. "He won't last 40 minutes in the car. Look at him." Pruitt looked at him. You could see her doing the math, the kind of institutional math that weighs liability against optics and usually comes up with the same answer. Not my problem, not my building, not my call to take. "I'm sorry," she said, and she sounded like someone who had practiced the phrase until it stopped meaning anything. "I can't authorize treatment of an animal in this facility. It's policy." The man stared at her for a moment. Not angry exactly. Something worse than angry. The look of someone who had been in situations where policies didn't apply, and people acted anyway, and was now standing in a world where the reverse was true. The dog made that sound again. Olivia was already moving. She hadn't made a decision exactly. The decision had been made for her by something older than decision-making. Some combination of 8 months of nursing training and 4 years of something she didn't talk about, layered together, responding to the information in front of her the way a system responds to input. The animal was in acute pain. The injury was significant. The handler was in crisis. She knew what to do. She crossed the ER floor and crouched 4 feet from the dog. She didn't move toward him. She stayed low, turned slightly sideways, and waited. "What are you doing?" Pruitt's voice, sharp from behind the desk. Olivia didn't answer. The dog's head swung toward her. The ears came forward. There was a rumble in his chest. Not aggression, exactly, but a warning, the automatic boundary setting of a working dog in pain who didn't know this person. Olivia held still. Let him look. Let him process her. She'd learned that military working dogs, properly trained, weren't just aggressive. They were discerning. They had been taught to read humans, to distinguish between threat and neutral, and even in pain, even under stress, the training didn't fully disappear. You couldn't rush it. You had to let the dog come to the conclusion on his own. "His name is Bravo?" she said, not to the dog, to the handler, conversational tone. Nothing urgent. "Yeah," the man said. He was watching her, recalibrating. "How long has he been weight-bearing on that side?" "He took the hit about 40 minutes ago. Wasn't bearing on it then either." "Any other trauma? Head, chest?" "Not that I saw. He was moving and then he wasn't." The dog had stopped rumbling. He was still watching her, but the quality of the attention had changed. The hair along his spine wasn't raised anymore. She extended one hand, not toward him, but toward the floor, palm down, just something in his visual field to examine. He sniffed the air between them. She let him. From the corner of her eye, she could see the ER had gone almost completely still. Nurses at the station, a tech halfway through the door to the supply corridor, a patient in a wheelchair by the window, all of them watching. Nobody speaking. Nurse Marsh. Pruitt's voice was tight with a particular kind of authority, the kind that gets quiet when it's most serious. Step away from that animal. Olivia did not step away. Marsh. The dog had lowered his head and touched her hand with his nose. Just a touch. Brief. But it was the most important thing that had happened in the room in the last 5 minutes. She shifted forward slowly, and he let her. She ran her hands along his side, reading the muscle tension, the breathing pattern, the way he held himself. Her fingers found the joint, and she felt him flinch, but he didn't snap, didn't pull away. The hip is displaced, she said to the handler. He's in a lot of pain. We need to get him off this floor, and I need something I can use for compression and stabilization while we figure out imaging. You're not figuring out imaging, Pruitt said. Step away right now, or I will call security. Olivia looked up at her supervisor. There was a moment, just a moment, where she weighed things. She was on probation. She had bills. She had a lease. She had a professional license she'd worked for and a record that she needed to stay clean. All of that was real. And then there was a 110-pound dog on the floor who was in agony, and a man in an army jacket with one hand who was holding himself together by sheer practice, and the knowledge, certain, specific, the kind that doesn't fit on a form, that she could help. Call security, Olivia said, but I'm not stepping away. The room made a sound, not a collective gasp, subtler than that, more like a shift in atmospheric pressure. Several people exchanged glances. A nurse named Tanya, who Olivia had worked with maybe a dozen times and spoken to maybe 100 words total, turned to face the station and crossed her arms and said nothing, but also didn't go back to what she was doing. Pruitt's face did something complicated. She picked up the phone. Olivia kept working. I need something for a compression wrap, she said, still focused on the dog. Rolled gauze, elastic bandage, whatever's in arm's reach. I'm not asking you to violate policy. I'm asking you to hand me materials that are sitting on an open cart 6 feet away. Nobody moved for about 4 seconds. Then Tanya reached over to the cart and pulled out a roll of elastic bandage and set it on the counter without looking at anyone. Thank you, Olivia said. She began wrapping. She'd done this before, not in an ER, but in conditions where the supplies were worse, and the ground was worse, and the patient, and sometimes the patients weren't human, was worse, and nobody had the luxury of hesitation. The body didn't forget how to do things it had done enough times under pressure. Her hands moved with the specific economy of someone who'd had to work fast in the dark. The dog held still. He was panting, shallow and rapid, but he was holding still. What's your name? She asked the handler, still working. Garrett Hale. How long were you with him? A pause. Not reluctance. Recalibration, the same kind she did when someone asked her something she had to decide how to answer. 4 years, he said. 2 deployments. He went with you. He always went with me. She finished the wrap, took a breath, and pressed her palm flat along Bravo's side. He exhaled heavily, and some of the rigidity went out of him. Not all of it, but enough. Okay, she said quietly. She heard footsteps behind her, says 2 sets. Heavy, purposeful. Security. She didn't turn around. Nurse! A man's voice, official, bored in the way people get when their job is to enforce things they didn't personally decide. You need to come with us. In a minute. Now, please. She stood up slowly, because sudden movement near the dog was a bad idea, and she turned to face them. 2 security officers, both bigger than her, both wearing the expression of people who expected this to be straightforward. Behind them, Pruitt. And behind Pruitt, someone Olivia recognized as the evening shift administrator, a man named Douglas Cole, 50-something, the kind of administrator who wore a tie even at 9 p.m. because the tie was the point, the tie was the message. Cole stepped forward. What exactly is the situation here? She violated a direct order and is treating an animal on hospital property, Pruitt said. She needs to be escorted out. Cole looked at Olivia, then at the dog, then at Garrett Hale, who was watching all of this with the steady attention of someone keeping an accurate record of events. "Is that accurate?" Cole asked Olivia. "The dog is a military working dog with a hip dislocation, and he will be in serious danger if he isn't treated in the next hour," Olivia said. "I've provided first-line stabilization. He needs imaging and pain management that this facility is capable of providing. We're not a veterinary facility. I understand that. I'm asking for an exception based on the animal's status and the handler's status. This is a decorated veteran." "I understand the handler's situation," Cole said, and his tone made clear that he'd already decided the handler's situation wasn't relevant. "But we have policies for a reason. We cannot open ourselves to liability." "You're already in the situation," Olivia said. "The dog is on your floor. The question is what you do now." Cole adjusted his tie. It was a specific gesture, the kind that meant the conversation was over, not because a resolution had been reached, but because someone with authority had decided they didn't want to keep having it. "Escort her out," he said to security, "and we'll need her badge." There it was. She'd known it was coming. She'd made the choice anyway, which meant she'd also made this choice. The consequence, the aftermath. She didn't pretend she hadn't known. She unclipped her badge and held it out. Garrett Hale said, "Wait, it's okay," she told him, and she meant it, which probably sounded insane. "The wrap will hold for a little while. Keep him calm, keep him still. Don't let them rush him." She handed her badge to Cole. He took it. She walked toward the doors, and the security officers fell into step beside her, not touching her, which was the polite version of escorting someone out. The version for when the institution wanted to maintain the appearance that it was civilized. She didn't look back. The automatic doors slid open, and she walked out into the October night, and the cold hit her like something official. The parking lot was partially lit and mostly empty at this hour. A wind came off the open country to the west, carrying the particular emptiness of high-altitude Wyoming autumn, that vast animal cold that came down from elevation and didn't care what it touched. She stood on the sidewalk outside the entrance and breathed. The security officers had stopped inside the doors. Their job was done. She was outside. That was the goal. She had no badge. She had a borrowed pen with a cracked grip in the pocket of her pale green scrubs. She had a car in the parking structure and an apartment 12 minutes away with a plant she kept forgetting to water. She'd just been fired. She found, somewhat to her own surprise, that the thing she felt most strongly in this moment was not panic, not even anger, exactly. She felt the particular flat clarity that had always come to her in the worst moments. The same clarity she'd felt in worse places, in darker situations, when everything that wasn't essential had been stripped away and what was left was just what was true, and what needed to happen next. She was going back inside for Garrett and Bravo. Not immediately. Not through the front entrance. She was going to find a different option. She was still thinking about what that option might look like when the sound reached her. Not from inside. From outside. From the entrance road that curved in from the street. A low, heavy sound. The kind made by vehicles with serious engines running at controlled speed. She turned. Headlights. Multiple sets, moving together, evenly spaced, the particular formation of vehicles traveling in convoy. They came around the curve of the entrance road without slowing and pulled into the hospital's main drop-off lane in a smooth, coordinated line that left no question about who had organized this or how many times they had done it before. 3 vehicles. 2 black government-issue SUVs and 1 military transport, shorter and more capable than civilian SUVs, the kind of vehicle that didn't have a logo on the side because it didn't need one. They stopped. The engines cut. The doors opened and people stepped out, and even in the partial light of the parking lot, everything about the way they moved communicated something clearly enough that Olivia went very still. These were not people who had come to ask questions. The lead figure walked toward the entrance with the specific purposeful stride of someone who knew exactly where they were going and had already decided what was going to happen when they got there. He was in his 40s, close-cropped silver at the temples, and he was wearing a uniform that Olivia recognized. Not the branch insignia, but the way it sat on the person wearing it, the way it communicated a specific kind of weight. He stopped when he reached the sidewalk. His eyes found her immediately, the way eyes find things when they know what they're looking for. He looked at her scrubs, at her empty collar where the badge had been, at the parking lot behind her and the hospital entrance in front of her. And then he said, in a voice that was quiet but not soft, "Are you the nurse?" Olivia looked at him for a moment. "I was," she said. He held her gaze for 3 seconds. Something moved behind his eyes. Not quite recognition, but the beginning of something in that direction. The kind of look people get when they're cross-referencing what they see against something they already know. He turned to the man beside him and said quietly, "Get the director." Then the doors slid open, and they walked in, and the automatic sound of the mechanism was the only thing in the parking lot. Olivia stood on the sidewalk in the cold Wyoming night, her badge gone, her shift ended, her career at Hargrove Regional Medical Center almost certainly finished, and watched military personnel walk into the building she'd just been thrown out of. She didn't go to her car. That would have been the rational thing. To walk back to the parking structure, drive home, sit with what had just happened, figure out the next step in the morning when the adrenaline had leveled off and she could think in straight lines. That was the sensible response to being fired at 9:47 on a Tuesday night in October. Instead, she stood on the sidewalk and watched the lights moving behind the glass of the hospital entrance, the shapes of people in uniform moving through the ER lobby with a purpose that the building wasn't designed for and didn't know how to absorb, and she understood with a certainty she couldn't have explained that she was not done here yet. The lead officer, she'd clocked his rank in the moment she'd seen him, the way she still automatically clocked ranks even after years of practicing not doing it, had gone through the doors without looking back. His people moved with him, efficient, controlled, the way people move when every step has been calibrated against the possibility of things going wrong. She gave it 60 seconds. Then she followed them in. The security officers who had escorted her out were gone, back to wherever security officers went between problems. The reception desk was manned by a single clerk who was staring at the lobby with the expression of someone watching a weather event develop outside a window. Nobody stopped Olivia when she came back through the doors. Nobody even looked at her. The gravity in the room had shifted, and the new center of it was not a former probationary nurse with no badge. The lead officer was at the station. Pruitt was in front of him. And even from across the lobby, Olivia could see what Pruitt's body language was doing. The particular configuration of someone who had been in charge of a situation 3 minutes ago and was no longer in charge of anything. She moved to the side of the lobby, close enough to hear but not so close she'd be noticed, and she listened. "Need to understand the nature of the animal's injury before we can authorize any kind of treatment," Pruitt was saying. Her voice had taken on a careful, managed quality, the voice of someone buying time. "Our policy on non-human patients, your policy," the officer said, "is not something I'm interested in at this moment. I need to know the current status of the dog and the handler and the nurse who was escorted out." A pause. "The nurse is no longer employed here," Pruitt said. "I understand that. I'm asking where she is." "She was asked to leave the premises." "And did she?" Pruitt glanced toward the entrance, and that was the moment her eyes found Olivia standing by the wall. The look on Pruitt's face cycled through several things quickly. Surprise? Then something that might have been relief before she suppressed it. Then the controlled expression of someone recalculating. "She appears to still be on the premises," Pruitt said. The officer turned. He found Olivia with the same directness he'd used in the parking lot, and he crossed the lobby toward her with the others tracking behind him at the appropriate distance. "I'm Colonel Darren Voss," he said, stopping in front of her. Not offering a hand, not unfriendly, just efficient. "You stabilize Sergeant Hale's dog?" "Compression wrap on the hip joint, temporary. He needs imaging and probably surgical intervention, or at minimum sedation and manual reduction." "Can you do that here?" "I can help someone who can. I'm not a veterinary surgeon." "But you're familiar with military working dog trauma protocols?" She held his gaze. There it was. The question underneath the question. She could see him reading her, the way he'd been reading her since the parking lot, trying to place what he was seeing against a category that fit. "Yes," she said. He studied her for another second. Something shifted in his expression. Not surprise exactly, more like the confirmation of a hypothesis. "Stay here," he said, and turned back toward the station. She stayed. The next 12 minutes were the kind of controlled chaos that looked from the outside like things falling apart, but was actually things getting reorganized around a new set of priorities by people who knew how to reorganize quickly. Colonel Voss spoke to Douglas Cole in the hallway outside the administrator's office, and though Olivia couldn't hear what was said, she could read the body language. Cole's initial posture of institutional resistance, the small adjustments as the conversation continued, and then the final shift, the moment where the tie adjusting stopped and the nodding started. Whatever Voss had said, it had worked. Cole came back out with a different face, not the managed, liability-conscious face of 9 minutes ago, but something raw and less certain, the face of a man who had just been handed information that changed the shape of the situation. He looked at Pruitt. He looked at Olivia. He looked at his own hands for a moment, which was the tell, the thing that said the recalculation was still happening. "Dr. Albright," he said to someone over his shoulder. "Get Dr. Wren from orthopedics on the phone." "Wren's not on call. Get her on the phone." Garrett Hale was still on the ER floor with Bravo, who had been moved to a space near the wall where the foot traffic wasn't directly on top of him. Someone had put down a trauma blanket. Not much, but something. Bravo was lying on his side now, his chest moving with the deliberate rhythm of an animal working to stay calm through significant pain. His eyes tracked the room. Even now, even like this, he was doing his job. Garrett looked up when Olivia crossed to him. There was a guardedness in his face that hadn't been there before, or maybe it had and she just hadn't been close enough to see it. He'd been watching everything from his position on the floor, cataloging it, and she recognized the quality of that watchfulness because she'd been accused of it herself. "You came back," he said. "I didn't get very far." She crouched beside Bravo and checked the wrap. It had held. She pressed 2 fingers gently at the joint, and the dog exhaled hard but didn't move. "He's been still," Garrett said. "He knows something's happening. They're getting someone from orthopedics. Vet surgeons coming from somewhere. I don't know where yet. They'll have to set up the imaging bay. They actually agreed to that." The colonel had a conversation with the administrator. Garrett made a sound that wasn't quite a laugh. "Voss has conversations with a lot of people," he said. "Usually they end the same way." She glanced at him sideways. "How long have you known him?" "Long enough." A pause. He rubbed his face with his right hand, the natural hand, and the motion was tired in a way the rest of him wasn't. "He was the one who called me, told me they were sending people. I didn't think they'd get here this fast." "Called you from where?" "Fort Caraway. It's about 90 minutes out." She did the math. They'd moved fast. Faster than they would have for a routine situation. Faster than 90 minutes of driving at legal speed should have produced, which meant either they'd been in the area already or they'd had reason to move at something other than a routine pace. She filed that. She didn't ask. The ER had returned to a kind of functional movement, but the texture of it had changed. People were doing their jobs, but they were doing them with an awareness of the military presence that showed in small ways. The way nurses made wider paths around the uniformed figures. The way the conversations at the station had dropped in volume. The way the charge nurse Dara Voss kept glancing toward the hallway where Colonel Voss and Cole had conducted their conversation as if she expected the hallway to explain itself. Pruitt had gone somewhere. Olivia noticed the absence before she identified it. The station felt different without the particular quality of Pruitt's attention managing the room. She'd retreated, probably to the supervisor's office, probably to make calls of her own. That was fine. Let her make calls. The problem with calls, in Olivia's experience, was that sometimes the person you called already knew more than you did. Dr. Wren arrived 31 minutes later, which was impressive given that she'd been at home and had driven in. She was a small woman in her 50s with gray-streaked hair pulled back from her face and the look of someone who had been pried out of sleep but was not going to let that slow her down. She assessed the situation in about 45 seconds, asked Olivia 3 specific questions about the injury presentation and what Olivia had found on palpation, and then she said, "Okay, we're going to need the imaging bay and we're going to need it cleared." And that was the end of the preliminary conversation. Olivia had not expected to be part of what happened next. She wasn't employed here anymore. She had no badge, no official status, no reason to be in an imaging bay or an operating suite or any part of this hospital that required clearance. But Wren looked at her when she started to step back and said, "Where are you going?" I don't. She gestured at her naked collar where the badge had been. I know. I'm asking where you're going. Olivia looked at her. I don't have clearance to be in imaging. You have my clearance, Wren said, which currently outranks whatever conversation happened earlier because the people who had that conversation are in the middle of a different problem. Come on. She didn't argue. She went. The imaging bay was a low-ceilinged room down a corridor from the main ER, and getting Bravo there was not a simple process. He was too heavy for Garrett to carry alone, and military working dogs didn't travel easily on hospital gurneys, even when they were healthy. Voss's team produced a hard-sided transport tray from the back of one of the SUVs, the kind of thing that didn't normally appear in hospital corridors, solid and fitted and designed for exactly this kind of situation. Bravo didn't like it. He made his opinion clear with a sound that echoed off the corridor walls and brought two nurses to their doorways, but he got on it because Garrett's hand was at his shoulder the whole time, and that was apparently still the one thing he trusted completely. Olivia followed them into the imaging bay and helped Wren interpret what the scanner showed, because Wren was an orthopedic surgeon and was excellent at reading bones and joints, but had not worked specifically with military working dogs, and wanted a second perspective on the structural configuration. The hip was dislocated, not fractured, bad but not catastrophic. There was soft tissue damage that was harder to assess without contrast, but the joint itself was intact. Manual reduction or surgical? Wren asked, more to herself than anyone. His age? Garrett answered from the corner where he was standing with his back against the wall. 6 years old, no previous major joint injuries. Manual reduction first, Wren said. Under sedation. If it doesn't seat properly, we go in, but I'd rather not unless we have to. She looked at Olivia. You're comfortable with the sedation monitoring? Yes. Good, because my anesthesia resident is at a conference in Denver and I'm not waiting for him. Olivia wasn't a veterinary nurse. She was an ER nurse with a skill set that had some overlap with what was needed here, and she'd done monitoring work in environments where the overlap between human and non-human emergency care was significant and nobody had time to care about the distinction. She was also not going to tell Dr. Wren that she couldn't help, because Bravo needed help and Wren was capable of providing it if someone handled what Wren couldn't simultaneously handle herself. She monitored. It was not a perfect situation. It was a hospital imaging bay pressed into service for something it wasn't designed for, with a veterinary surgeon working outside her usual environment, a combat veteran standing in the corner trying not to show how badly he needed this to work, and a former nurse with no institutional standing keeping track of vitals on an animal whose baseline she'd had to estimate from Garrett's description and her own experience. The sedation took longer to calibrate than it would have in a proper veterinary suite. Bravo fought it a little, the way trained dogs fight sedation. Not from panic, but from some deep instinct against losing awareness. And she talked him through it, the same low, continuous murmur she'd used in the lobby. Not words exactly, just sound, just presence. When he went under, Garrett let out a breath that he'd probably been holding for 40 minutes. The reduction took 11 minutes. Wren was precise and efficient and didn't appear to be aware that this wasn't standard practice, which was its own kind of skill. The joint seated. The sound it made was the kind of sound that nobody commented on at the time, but that everybody in the room would probably think about later. There, Wren said. She stripped off one glove and reached for a new one. Let's see the contrast imaging, and then we talk about the soft tissue. They were 40 minutes into this process when the door opened. It wasn't Colonel Voss. It was Douglas Cole, and with him was a woman Olivia hadn't seen before. 50s, iron gray hair, a suit that didn't belong in an ER at 11 p.m., the particular posture of someone whose presence was itself a statement. She had a lanyard with a hospital administration badge and the specific energy of someone who had been called in and was not happy about the circumstances of the call, but was going to manage them anyway. Dr. Wren, Cole said, and even his voice was different now. Something had happened in the time since Olivia had last spoken to him. This is Dr. Patricia Engel. She's the regional medical director. Wren looked up from the imaging display. Good timing, she said, which was not the response Cole had been expecting, based on his expression. I could use someone with authority to authorize the post-reduction care plan. We'll need overnight monitoring and a specialist consult in the morning. Cole blinked. Dr. Wren, I don't think you understand the situation. I understand a dislocated hip joint that I have just reduced successfully, Wren said. I also understand that this animal has an active military service record, which creates a specific set of obligations that I'll let Colonel Voss explain in more detail. What I need right now from either of you is authorization to continue care. Engel spoke for the first time. Her voice was clipped, controlled. I've just spent 20 minutes on the phone with the Deputy Surgeon General's office, she said. I'm aware of the situation. Cole's head turned slightly. That was new information to him too, apparently. The hospital will provide whatever care is necessary, Engel continued, for the dog and for Sergeant Hale. That is not the issue I'm here to address. She looked at Olivia. The look was thorough, the kind that files things. You're Marsh? Yes. You were terminated tonight. I was. By whom? Mr. Cole and Supervisor Pruitt acting together. Engel looked at Cole. Cole's expression was now doing something that Olivia recognized as damage control mode. The specific facial configuration of someone figuring out how much of what just happened can be reframed or redistributed. The termination was pursuant to policy, Cole said. The nurse violated direct orders. She stabilized a military working dog using skills she apparently has, Engel said, still looking at Cole, but talking about the situation. While on duty in an ER where a medical judgment call was required. A pause. I've also just been told that a Colonel Voss of Special Operations Command has formally requested that the hospital document and review tonight's events, which means someone in this building made a decision that is now going to be reviewed by people with considerably more institutional weight than this facility's evening shift administration. Cole's mouth opened. Then it closed. We can discuss the specifics later, Engel said. Tonight, I want care plans for the dog and the veteran, and I want a preliminary incident report on my desk by 7 a.m. She looked at Wren. You have everything you need? I will if someone gets me a proper veterinary monitoring setup by morning. It's being arranged. Engel glanced again at Olivia. Not warm, not hostile, just precise. The look of someone making sure they have all the elements of a situation accounted for. Don't go anywhere, she said, and walked back out, and Cole went with her, and the door closed. The room was quiet for a moment. Garrett said from his corner, That woman is terrifying. She's doing her job, Olivia said. That's what I said. Wren snorted once, which was the closest she seemed to come to open amusement, and went back to her imaging display. Olivia stood at the edge of the room and let herself breathe for the first time in what felt like a while. The adrenaline had been a constant low-grade presence for the last hour and a half. Not the sharp spike of a crisis moment, but the sustained, wearing kind that accumulated over a long stretch of sustained difficulty and left you tired in the specific way that wasn't fixed by sitting down. She was tired. She'd been on her feet since 7:15 and the shift was supposed to end at 7 a.m., and none of what had happened since 9:40 was what a shift was supposed to look like. She was also, she noticed with a kind of detached awareness, no longer fired. Or at least the situation had become sufficiently complicated that fired was no longer an accurate description of her status, which was not the same as employed. It was something murkier and less stable than either, a position that depended on conversations she wasn't part of and decisions that hadn't been made yet. That was fine. She knew how to wait. She'd been trained to wait, in circumstances where the waiting itself was a skill and patience wasn't a virtue but a tactical requirement. She watched Bravo's chest rise and fall. She'd met dogs like him before. Not many. The specific combination of training and temperament and service history that produced a military working dog at the top of his capability was rare. The same way it was rare in people, and for the same reasons. It wasn't about intelligence alone, or obedience alone, or courage alone. It was about all of those things shaped by experience until they stopped being separable from each other. Bravo had been doing his job for 6 years in conditions that would have broken a civilian animal in weeks. Whatever ease he'd shown in letting her touch him, that hadn't been trust exactly. It had been assessment, the same kind of rapid professional reading that good soldiers did, and she was apparently someone his system had cleared. She wasn't sure what to do with that. She rarely was. At 11:43, one of Voss's men knocked and opened the door and said, "Colonel wants to see the nurse. and Garrett looked at Olivia, and she looked at Garrett, and he gave her a small nod that meant something, though she wasn't completely sure what. She followed the soldier out. Voss had set up in the small conference room adjacent to the administrator's suite. The one with the round table and the motivational wall graphic, and the bad overhead lighting that made everyone look like they were recovering from something. He was standing rather than sitting, which told her something about his energy level and probably his assessment of the situation. Two of his people were in the room with him, tablets out, the specific posture of people ready to document. He waited until the door closed before he spoke. "Sergeant First Class Olivia Marsh," he said. 7-4D, Chemical Corps, cross-trained combat medic. Attached to JSOC elements on 2 overseas deployments before leaving service 3 years ago. Honoring a voluntary separation agreement. He said it without inflection. Not a question, but also not quite a statement. A recitation offered for her to confirm or correct. She said nothing for a moment. "You did your homework," she said. "We had your file before we left Caraway. Hale flagged you the moment he called in." "He didn't know my name." "He knew enough. Female ER nurse, combat medic background, made a military working dog stand down in an active state, wrapped a dislocation by touch in the middle of a lobby." Voss's expression shifted fractionally. "There aren't that many people that description fits." The room was very still. She'd left the army without a ceremony, which had been her choice and not something she regretted, but the absence of ceremony had also meant the absence of closure, which was a different thing, and she'd been carrying the difference for 3 years in ways she didn't examine too closely. And now she was standing in a bad lighting conference room in a Wyoming hospital at nearly midnight while a colonel recited her service history, and part of her was responding to it with something she didn't have a clean name for. "What do you want from me?" she said. "Right now?" "Your statement about what happened tonight, for the record." He gestured at the chair across the table. "Sit down." "I don't—" She stopped. Sat down. He sat across from her. One of his people opened a document on a tablet. "Start from when Hale arrived," Voss said. "Tell me what you observed and what you did. Don't editorialize, just the sequence." She told him. She was good at that. The factual account, the sequence without the interpretation layered in, the precise language of someone who had written enough field reports to know how to separate event from analysis. She told him about Hale coming through the doors, about Bravo's condition and what her assessment showed, about Pruitt's response in Coles, about the decision she'd made and the badge she'd handed over. He listened without interrupting. His people documented. When she finished, he was quiet for a moment, the kind of quiet that was still processing rather than waiting for her to continue. "You knew when you stepped forward that it would cost you the job," he said. "I considered the possibility." "And you did it anyway." "The dog was in pain. I could help." "That's the whole answer?" She thought about it. Not the diplomatic version, the actual version. "I've been in situations where someone who could help decided not to because of the cost," she said. "I've also been in situations where someone helped anyway. The outcomes aren't equivalent." Voss held her gaze for a moment. Then he said, "There's something I need to tell you, and I need you to hear it before the rest of tonight becomes public, because once it does, the context will matter." She waited. "Garrett Hale's file is classified above the level that hospital administrator will ever read," Voss said. "What I can tell you is that the mission he and Bravo were part of 13 months ago resulted in the recovery of 3 hostages and the disruption of a supply network that had been active for 8 years. A pause. Bravo located a device that would have killed 6 operators. Hale got him out under fire. The dog took shrapnel to the flank doing it. Another pause, this one longer. "We don't forget that." She was quiet. "The medical director's call to the DSG's office wasn't routine," Voss continued. "There are people at a level above this hospital who are now aware of what happened tonight. Not just the dog, the whole night, including who was terminated and why." She understood what he was saying. She wasn't sure yet what it meant for anything practical. "There's going to be a review," she said. "There's already a review. It started about 40 minutes ago." She absorbed that. "Cole?" "Cole made decisions tonight that he's going to need to explain in a venue where his explanations will be carefully evaluated." Voss said it without particular satisfaction. It was a statement of process, not triumph. "Pruitt as well." She was following protocol. She was choosing how to follow it, Voss said. That's different. The conference room door opened. One of Voss's soldiers, a younger man, sharp-faced, with the look of someone who had been moving fast since they'd arrived, leaned in and said, "Sir, we have a situation." Voss's posture changed, not visibly much, just a degree of attention that hadn't been there before. "What kind?" "Mr. Cole just left the building." A beat. "He was told to remain on premises," Voss said. "Yes, sir. The security desk says he left about 6 minutes ago through the staff parking exit. His car is gone." The room was very quiet. Voss stood. He looked at Olivia for a brief moment, and then he looked at his people. And whatever he communicated in that look sent them moving, and he was already talking into a radio as he walked toward the door. Olivia sat at the conference table alone. Cole had left. She thought about that, about the timeline, about when he'd come into the imaging bay with Engel, about the look on his face when Engel had said the words Deputy Surgeon General's office, about the specific quality of his retreat when Engel had shut down his explanation of the termination. She thought about a man who'd spent the night making decisions from behind institutional policy and was now, apparently, making a different kind of decision. People who ran when the accounting started usually had more to account for than the immediate situation explained. She sat with that. In the imaging bay down the corridor, a military working dog was sedated and recovering from a successfully reduced hip dislocation. His handler was sitting on a folding chair against the wall, probably also recovering from a successfully reduced something, the internal version that didn't show up on scans. Dr. Wren was reviewing the soft tissue imaging with the careful attention of someone who didn't sign off on anything before she understood it completely. And somewhere in the parking lot or on the road leading out of it, Douglas Cole was driving away from a situation he clearly understood better than anyone had realized. Her phone buzzed in her pocket. Unknown number. Wyoming area code, but not one she recognized. She answered. "Marsh," she said. The voice on the other end was not one she expected. Female, older, precise. A voice that had given instructions in large rooms to people who wrote them down. A voice she had last heard 3 years ago, in a different context, in a different life. "I heard you had an interesting evening," the voice said. Olivia's hand tightened on the phone. "Colonel Hartwell," she said. "Retired," the woman on the other end said, "but apparently not entirely disconnected from current events." A pause. "You should know that the conversation about tonight isn't happening at the hospital level anymore. It's moved up. And there are some things about the people you're dealing with that you don't have yet, Marsh. Things that explain why Cole left the building." Another pause. "How much do you know about how Bravo got injured tonight?" Olivia went still. "Garrett told me it was an impact injury," she said, 40 minutes before he arrived. "It was," Hartwell said. "The question is what caused the impact? And the answer to that question is why 3 vehicles left Fort Caraway at unsafe speeds and why I'm calling you from a number you don't have stored." The lights in the conference room hummed. "Tell me," Olivia said. Hartwell's voice on the other end of the phone had the particular quality of someone choosing words, not because they were searching for them, but because each one had been weighed before the call was made. "Bravo didn't take an accidental impact," she said. "There was a vehicle involved. A deliberate one." Olivia didn't respond immediately. She was processing the shape of what was being said before she reacted to the content of it. "Someone hit the dog intentionally," she said. "Someone hit Garrett Hale's truck intentionally," Hartwell said. "Bravo was in the bed, unsecured transport. They were moving fast, had come from a meeting that wasn't supposed to be logged. The vehicle that hit them came from a side street at speed, made contact with the rear quarter panel, and was gone before Garrett could respond. He's got one hand and a truck that's now missing a rear axle. He couldn't exactly pursue." "Where did this happen?" 3 miles from the hospital, which is not a coincidence, Marsh." She turned this over. 3 miles. Which meant the hospital had been the destination, not a detour. Which meant Garrett and Bravo had been coming to Hargrove Regional specifically before the impact, not because it was the nearest facility after it. "Why was Hale coming here?" she asked. A beat. Short, precise. "He had a meeting scheduled with Douglas Cole." The lights in the conference room hummed. She said, "Cole." Cole has had 3 meetings with Garrett Hale in the past 6 weeks, Hartwell said. None of them logged through official channels. None of them with institutional paperwork. Hale had been pushing a formal complaint, not through military channels, through a civilian oversight board that Cole apparently sits on in an advisory capacity. Something Hale dug up about procurement irregularities on the equipment side of military working dog programs. Specifically, about contractors providing substandard protective equipment for deployed working dogs. Olivia's jaw tightened. Bravo's flank injury, she said, 13 months ago. The shrapnel vest he was wearing during that operation was rated for a protection standard it didn't meet, Hartwell said. We know that now. Hale has documentation, and he had been apparently getting close to someone who was going to help him submit it through the right board. Cole. Cole has been managing that process, Hartwell said, or managing Hale, depending on how you look at it. The meetings weren't to help him. They were to track where the documentation was and keep it contained. We believe Cole knew Hale was bringing physical copies of the documentation to their meeting tonight. And then a vehicle hit the truck, Olivia said. Bravo went down. Hale went to the nearest hospital, and the physical documentation he was carrying was in a bag in the truck that ended up 60 feet from the impact site. Is it recovered? Voss's people have it. A pause. Cole didn't know that when he left the building. He left because he understood the review was starting, and he has personal exposure, financial, administrative, possibly criminal. He's not just an administrator who made a bad call tonight, Marsh. He's been a point of contact for the contractor involved in the equipment failure for 2 years. The room was very quiet around her. She thought about Cole in the imaging bay, standing next to Engel, his face doing its damage control calculation. She thought about how efficiently he'd moved to terminate her, not with anger, with process, with the specific speed of someone who wanted a potentially disruptive variable removed from the situation before it could see anything it shouldn't. She hadn't been fired for violating policy. She'd been fired because Cole needed her out of the room. Why are you telling me this? She said. Because Voss is going to ask you to do something in the next hour, Hartwell said. And you should understand the full picture before he does. Not the operational summary, the actual picture. She paused. And because you left without a record, and I always thought that was the wrong call, even if I understood why you made it. That landed differently than Olivia had expected. She breathed through it. What is Voss going to ask me? There's a patient in your ER, Hartwell said. Came in about 20 minutes ago while you were in that conference room. Civilian, 43 years old, male, presenting with chest symptoms. His name is Warren Selby. He's a financial analyst formerly employed by Dunmore Logistics, the contractor that provided the substandard equipment. He left Dunmore 14 months ago, and his departure was not voluntary. He's been living in Delwood for 7 months. A pause. He has his own documentation, his own records. He came to the ER tonight because he's been trying to reach Hale through back channels for 2 weeks, and someone told him Hale would be at Hargrove Regional tonight. His chest symptoms, Olivia said. Stress-induced cardiac event is the preliminary read. He's stable, but he needs monitoring, and he's going to need someone who can talk to him without a badge. She absorbed the layering of it. Selby had known Hale was coming, which meant Selby also had some awareness of what Hale was trying to do, and of what Cole's role was, and he'd timed his arrival for when he thought there would be military presence to absorb the shock of what he was carrying. He came to a hospital for protection, she said. He came to a hospital because he's been scared for 14 months, and tonight seemed like the first moment where the people he was scared of might be outweighed, Hartwell said. Also possibly because his chest had been hurting for 6 hours, and he finally couldn't ignore it. Those aren't mutually exclusive. No, Hartwell said. They're not. A pause. And when she continued, her voice had shifted slightly. Not softer exactly, but a fraction less precise. The way voices shift when the professional layer and the personal layer briefly occupy the same sentence. You're good at this, Marsh. You were always good at this. Go do the job. The call ended. Olivia sat with the phone in her hand for approximately 4 seconds. Then she stood up and went to find Voss. He was in the corridor outside the administrator's suite, on his own phone, moving in the contained way of someone managing 3 things simultaneously. He saw her coming and held up one finger. Wait. And she waited, because she'd learned that the specific quality of that gesture from someone like Voss meant he'd get to her in under 90 seconds, and interrupting would cost more time than waiting. 80 seconds later, he ended his call. Hartwell reached you. Yes. Good. Then I don't have to explain the Selby situation. He fell into step, heading toward the main ER corridor, and she moved with him. He's in bed 7. Dr. Albright is managing the cardiac workup, but Albright doesn't know who he is or why he's here, and I'd like to keep it that way until we have a clearer picture of who in this building knew what. You think Albright is connected to Cole? I don't think anything yet. I'm not assuming anyone is clear until I know they are. He glanced at her sideways. You're not officially staff here, which means you can have a conversation with Selby that doesn't get logged as a clinical encounter. Understand? You want me to talk to him? I want you to sit with him and let him talk, Voss said. There's a difference. Don't ask leading questions. Don't push. He's been scared for over a year, and he came here on a risk calculation. And if we crowd him, he'll close. A pause. You're good with scared people. Hale told me what you did in the lobby. Not just with the dog, the way you managed the room. That's a skill. It's just reading people, she said. Most people can't do it, he said simply, and stopped outside bed 7's curtain. Give me whatever he gives you. I'll be within earshot. He stepped back. She pushed the curtain aside and went in. Warren Selby was not what she'd expected, though she wasn't sure what she had expected. He was pale and slightly damp-looking, the physiological signature of someone whose sympathetic nervous system had been running hot. The cardiac monitor showed a rhythm she assessed in her first 3 seconds as stable but stressed. Elevated rate, some irregularity that was going to need watching but wasn't the immediate emergency. He was hooked to an IV line that was currently running saline, and there was a nitro patch on his upper chest that Albright had apparently placed before moving on to other cases. He was also watching the curtain the way people watched things they expected to become problems. When he saw her, scrubs, no badge, not the doctor he'd been dealing with, some of the watchfulness shifted but didn't disappear. "Who are you?" he said. His voice was tired and slightly hoarse, the voice of someone who hadn't been sleeping much. "Olivia, I work here. Half true or true enough?" She pulled the chair from the corner and sat, which was the most important physical thing she could do. Get below eye level, stop being a person standing over a bed, become a person having a conversation. "How's the chest?" "Manageable," he said. "Better than an hour ago." "Good. The nitro helps?" "I think so." He shifted against the pillow. He had the look of someone who wanted to ask her something and was trying to determine whether it was safe to do so. She let the silence sit. Did someone named Hale come in tonight?" "He did," she said. His exhale was shaky. He's here. He's okay. The dog's going to be okay too." She watched his face. The relief that moved across it was genuine and complicated. Not just the relief of good news, but the specific relief of someone whose risk calculation had produced the outcome it needed to produce. He'd bet something on coming here tonight, and it had come out right, and the emotion of that was bigger than he'd probably expected. "I didn't know who else to—" He stopped, started again. "I've been trying to figure out how to—" He pressed his fingers against his sternum. "Not a symptom, a habit. I have information." "I know," she said. His eyes sharpened. "What do you know?" "Enough to know that you've been carrying it a long time, and that you came here because tonight felt like the moment." She held his gaze steadily. "Nobody here is going to hurt you. The people in this building right now include military personnel who are very much aware of the situation. You made the right call coming." He was quiet for a moment, recalibrating against what she'd said. "Dunmore ran the contract for 14 working dog protective equipment deployments over 3 years," he said. And once he started, his voice found a rhythm, the rhythm of someone who has rehearsed a thing in their head so many times that saying it out loud is almost a relief even when it's terrifying. "I was in procurement analysis. My job was cost-benefit modeling on material specifications. I flagged the vest spec 18 months ago. The ballistic protection rating was documented as meeting SOCOM standard, but the actual test data showed an 18% shortfall in penetration resistance at relevant threat velocities." She said nothing, let him continue. "I raised it internally, twice. The second time, my supervisor, a man named Reith, Paul Reith, told me the contract was fully compliant and that my modeling was based on incomplete data. 3 weeks later, my access credentials were revoked, and I was told my position had been restructured. The fingers pressed his sternum again. I knew what that meant. I started making copies. Physical copies, she said. Physical, encrypted drives, redundant backups. And I started reaching out, carefully. He looked at his hands. Hale reached back. He'd already started digging from his end. He knew Bravo's vest had failed. He just didn't know why. We were building toward the same thing from different directions. And Cole? His expression shifted. Cole knew about my documentation. I don't know how. I was careful. I thought I was careful. But about 6 weeks ago, Hale told me that Cole had approached him. Not directly. Through intermediaries, said he could help facilitate the complaint submission, said he had channels. He shook his head. Hale was skeptical. I told him to be very skeptical. And then tonight, someone hit his truck, Olivia said. Selby's face went flat. I heard the emergency call on a scanner app I've been running since I live 2 miles from where it happened. I heard Hale's description, military working dog, hip injury. I knew. He swallowed. I drove here as fast as I could, with chest pain. The chest pain started when I heard the scanner. He said it with a kind of bleak self-awareness. I'm not an idiot. I knew what it might be. I also knew I needed to get somewhere with people who... He stopped. Who were on your side, she finished. Who at least weren't on theirs, he said, which was a more precise formulation than hers and probably more honest. She sat with it for a moment. Then she said, I need you to tell me about Paul Reith. He looked at her. He's the supervisor who shut down your internal flag, she said. He's also currently on a government advisory panel for defense procurement, Selby said. He was appointed 7 months ago. I found out 4 months ago. I haven't been able to sleep properly since. The curtain moved. Not Voss, one of his people, younger, and she looked at Olivia with a specific expression that said something had changed in the last few minutes in the part of the building she hadn't been in. She stood. I'll be right back, she told Selby. You're not going anywhere. I'm hooked to a heart monitor, he said, a little flatly. No. She stepped outside the curtain. The soldier, she'd clocked the name tape earlier, Devereaux, spoke in the low, precise way of someone communicating information that doesn't need to be overheard. Cole's vehicle was found, she said. He didn't leave town. He's parked at a property 4 miles north of here. Rural address. No prior connection to Cole on record, but it's registered to a holding company that's been associated with Dunmore Logistics in public procurement documents. Olivia absorbed that. He went to a Dunmore property. Looks like it. Voss is coordinating with county sheriff. It's outside our jurisdiction, but they're cooperating. There's also... Devereaux paused, the way people pause when the next piece of information is worse than the previous ones. There's a second issue. Selby's encrypted drives. He said he had redundant backups. One of them was in his car. His car was broken into in the hospital parking lot sometime in the last 45 minutes. The drive is gone. She went still. Someone had followed Selby to the hospital, or had been watching the hospital and identified his car. Either way, someone had moved fast, and that kind of fast movement didn't happen without coordination, which meant the network that Cole was part of had more local reach than anyone had accounted for. Does Selby know? She asked. Not yet. Don't tell him until his cardiac markers come back, she said. The stress response could push him back into an acute event. Let Albright manage the next hour. She was already moving. Where's Voss? He was in the corridor outside the administrator's suite again, which appeared to have become his default position, and he was on the phone again, but when he saw her face, he ended the call. She told him what Selby had told her. The procurement flag. Reith. The advisory panel appointment. He listened without interrupting, and when she finished, he was quiet for 3 seconds. Not processing, she thought, confirming, cross-referencing against things he already knew or suspected. Reith, he said. You know the name. I know the name, Shek, he said. It appears in Hale's documentation twice. I didn't have a full picture of the connection to Cole until now. He looked at her steadily. This is bigger than a contractor cutting corners on a vest spec, Marsh. This is a procurement network that's been providing substandard equipment across multiple contracts and using administrative channels to suppress the flagging mechanism. Selby's analysis is probably the cleanest documentation of the pattern we have. One copy is gone, she said. One copy, he said. Selby mentioned redundant backups. He has more. Where? She shook her head. I didn't ask. You said don't push. She met his eyes. But I can go back. He nodded once. Go. She went back to bed 7, and the conversation she had with Selby in the next 7 minutes was the most careful conversation she'd had since leaving the army. Careful in the way field operations were careful, where the order of information and the framing of questions shaped outcomes, and the wrong word at the wrong moment could close a door that wouldn't open again. She told him about the drive. She did it the way Hartwell had always said to deliver bad news. Directly, briefly, without softening it to the point of distortion, and with the next step already in the sentence. She watched his face go through the cycle. Shock, then the specific bleached look of someone whose fear has just been validated in the worst way. Then something harder and more resolute that came up under the fear, the way bone came up under tissue. I have 2 other copies, he said. When he said it, his voice was steadier than she expected. One is in a safety deposit box in a bank in Casper. The other, he stopped. He looked at the ceiling for a moment, some internal calculation happening. The other one I emailed to myself 3 months ago, encrypted. The key is in my head. Only your head? I wrote the key in a notation system I developed when I was 22 years old and haven't used since, he said. It's in a journal that looks like a birding log. It's in my apartment. Can you access the email from here? If someone gets me a laptop with a browser, yes. She stood up. Give me 10 minutes. The next 10 minutes were logistically complicated in the particular way that hospital nights became complicated when multiple systems were operating simultaneously and the people managing them had different information. She got the laptop from Devereaux, who had apparently anticipated the need and had one ready, which told her something about Devereaux's operational competence. She brought it to Selby. She stood outside the curtain while he worked, because the specific technical steps of what he was doing were not things she needed to witness, and because giving him a private moment in which he was doing something active rather than waiting was better for his cardiac situation than the alternative. She was standing outside the curtain when she became aware that the ER had changed again. Not dramatically, not with the alarm weight of a new emergency, or the formal shift of Voss's people moving on a specific task. Just a quality of attention at the nursing station that was different from 5 minutes ago, the particular body language of people who have received information and haven't fully processed what to do with it. She walked to the station. Tanya, the nurse who had handed her the elastic bandage hours ago without looking at anyone, was at the desk. When she saw Olivia, she did something with her expression that was not quite a smile, but was in that direction. Pruitt's in with Engel, Tanya said without preamble. Has been for about 30 minutes. Nobody's come out. How's it sounding? Like a meeting where someone's career is being ended, Tanya said, with the directness of someone who had been watching Pruitt manage the ER for long enough to have a perspective on the event. Engel's assistant has been in and out pulling personnel files. Which files? Pruitt's, Cole's, and someone named Albright. Olivia looked at her. Albright. He and Cole have had lunch together every Thursday for 6 months, Tanya said. I eat in the cafeteria. I noticed. She paused. I also noticed that about 20 minutes after Cole left, Albright went outside through the ambulance bay. He came back in about 8 minutes later. I don't know what that means. 8 minutes. Long enough to do something in a parking lot. Selby's Drive. She moved back toward bed 7 with the particular speed of someone who has connected 2 points and is following the line between them, but before she got there, Voss appeared at her shoulder. She hadn't seen him approach, and the fact that she hadn't was either a testament to his movement discipline or an indication of how much her attention had scattered in the last 2 minutes. Albright, she said. We know, he said. Devereaux pulled his hospital access logs 20 minutes ago. He badged into the imaging bay during Bravo's procedure. She stopped walking. He was in the imaging bay? For 4 minutes. He didn't enter the room, but he badged into the corridor. Voss's voice was controlled, but underneath it was a specific tension. The tension of someone recalibrating a threat picture in real time. Albright has credentials that allow him corridor access that most staff don't. If someone needed to know the layout of the building, where Hale was, where Selby was, where the military personnel were positioned, Albright could have provided that. He came back inside 8 minutes after going out, she said. Tanya saw him leave through the ambulance bay. We're getting security footage now. He looked at her directly. The woman you're talking to about Selby's documentation. How close is she to having it? He's accessing the email now. Maybe 5 minutes. Get it to me the moment it's accessible. He was already turning. And Marsh, stay away from Albright. If he made contact with someone outside in that parking lot, we don't know who's responding to what he told them. She understood what he wasn't saying. If Albright had reported Selby's location inside the hospital, and if the people he'd reported to were the kind of people who moved fast, the same kind of people who hit a truck in the dark at speed, then the hospital was not necessarily the safe location that Selby had calculated it to be. She went back to bed 7. Selby had the email open. The file was downloading. It was large. She could see from the indicator that it was several hundred megabytes of compressed documents. And the hospital Wi-Fi was functional but not fast. And the download bar moved with the particular aggravating incrementalism of a large file on a medium connection. 42%. She pulled the chair close and sat facing the curtain, which meant her back was to Selby, and her eyes were on the gap where the curtain met its rail, the strip of corridor visible between fabric and wall. Old habit. The kind she'd tried to stop and hadn't fully managed. 51%. She heard something, not loud, not a crash or a shout. The ER had those routinely. This was subtler. A change in the sound pattern of the corridor 2 sections down from where she sat. A door, but not the automatic kind. A manual push door opening with a specific weight. And then footsteps, but not the rubber-soled clip of nursing staff, something with a different sole, a different pressure distribution. 63%. She stood. She moved to the curtain gap and looked. The corridor was normal. 3 nurses, 1 tech, the usual movement. But at the far end, near the corridor that connected to the ambulance bay, there was a figure she didn't recognize. Male, civilian clothes, not patient body language. He was looking at his phone and walking slowly, the specific performance of someone who was moving through a space they weren't supposed to be in and was hoping the performance of casualness would cover it. He was 40 feet away. He glanced up and his eyes swept the corridor. She let the curtain fall. 78%. She turned to Selby. When that finishes downloading, can you forward the email to an address I give you? He looked at her face. He was pale, paler than 30 seconds ago. What's happening? Someone who shouldn't be in this corridor is in this corridor, she said, keeping her voice level, clinical, the voice that said, this is information, not an emergency, even when it might be an emergency. Forward the file to Colonel Voss as soon as it's done. She gave him the email address Voss had written on a card that Devereaux had handed her earlier, and she was grateful for the specific operational habit of people who prepared for things rather than reacting to them. He took the card. His hand was not entirely steady. What about you? He said. She looked at the curtain. 89%. I'm going to go have a conversation, she said. She stepped outside. The figure was closer now, 25 feet. And when she stepped through the curtain, he registered her immediately. The way people registered things they were watching for rather than things they were merely encountering. The eye contact lasted less than a second before he looked away, but that second contained a specific quality of recognition. He knew who she was. She started walking toward him, and the corridor behind her erupted. Not gunfire, nothing so dramatic, but the ambulance bay door swung open hard, faster than a patient arrival, and 2 figures came in moving with purpose, and they were not hospital personnel, and they were not Voss's military team. And Olivia assessed all of that in about half a second and was already shouting before she'd made the conscious decision to shout. Voss! Her voice went down the corridor at volume, the specific carrying note of a field medic used to communicating over noise. Ambulance bay, now! The nearest figure was 7 feet from her when she moved, and what she did in the next 4 seconds was not elegant. It was not the movie version of someone with combat training. It was the specific and unglamorous application of the practical techniques she'd spent years practicing for exactly the reason that grace wasn't the point. Effectiveness was. She put herself between the figure and Selby's curtain, and she made herself difficult to move. And when the man's hands came up, she blocked hard and used his own forward momentum against him in the way that worked on surprised people who weren't expecting resistance from a woman in green scrubs with a cracked grip pen in her pocket. He went into the wall. Not down, just into the wall. But it bought 4 seconds, and in those 4 seconds, the corridor filled with people in uniform. Voss's team moved like water filling a space. No hesitation, no visible communication, just the instant coordinated response of people who had trained for exactly this. The second figure was contained before he'd taken 3 more steps. The first was off the wall and being held by someone a great deal larger and more professionally equipped for the task than Olivia by the time she'd taken her next breath. She stepped back. Her shoulder hurt. She'd taken impact when the man hit the wall, and she'd absorbed part of it, and the specific burn of that was starting to register now that the immediate task was done. She rolled the joint once, assessed the range of motion, decided it wasn't structurally damaged, and filed it. Voss was beside her. He looked at her shoulder with the practiced eye of someone who checked people for injury as automatically as other people checked the time. "You okay?" "Yes." "Sure?" "Shoulder, not structural." He held her gaze for a beat, then looked at the 2 men being held by his team, and then back at her, and the expression on his face was something she couldn't entirely read, somewhere between professional concern and something less categorizable. "You were supposed to stay away from Albright," he said. "It wasn't Albright," she said. "These are 2 people I've never seen." "I know who they are," he said, which was a statement she hadn't expected. Or rather, I know who employs them, the same company that employed Selby. Dunmore Logistics. She looked at the 2 men. Civilian clothes, fit, the specific blank professional look of people who did things on behalf of organizations that maintained plausible distance from the things being done. Not military, but trained, the way certain private sector people were trained. Close protection background, probably. Or something adjacent. "They knew where Selby was," she said. "Albright," Voss confirmed. "We have the footage. He was on his phone for 6 minutes in the parking lot, and we have his call log now. He called a number that traces to a shell company 3 layers away from Dunmore, but not so deep we couldn't follow it." He paused. "Albright is currently in a room with my people explaining his Thursday lunches with Douglas Cole." "And Cole?" "Still at the Dunmore property. County sheriff has the perimeter. We're waiting on authorization to go in. It's a civilian jurisdiction situation." He said jurisdiction with the compressed frustration of someone who respected legal processes and was also acutely aware of how legal processes could be used as time. "We'll have it within the hour." She absorbed all of this. The corridor had stabilized. Voss's people had moved the 2 men efficiently, and the ER patients who'd been aware anything was happening were being managed by nurses who were doing the specific calming work that ER nurses were very good at. Behind the curtain to bed 7, she could hear the sound of a laptop keyboard. She went back in. Selby was looking at his screen, and his face was doing something she'd learned to read in people who had been holding a weight for a long time and have just put it down somewhere secure. Not relief exactly, because relief implied the problem was over, and the problem was not over. More like the particular muscular release of someone who has been clenching without knowing they were clenching. "It's sent," he said. She checked her phone. Voss's contact number. He'd given it to Devereaux to give to her, another instance of preparation she was grateful for. She typed, "File incoming from Selby. Email sent 30 seconds ago." His response came in 11 seconds. "Received. Authenticated. Making copies." She showed Selby the message. He read it twice. His cardiac monitor was showing a rate that was still elevated but had come down from its earlier peak, and the rhythm was cleaner. Not good exactly, but improved. The body doing what it did when the adrenaline curve started its decline, and the parasympathetic system started cautiously reasserting itself. "What happens now?" he said. It was a genuine question, not rhetorical, and she gave it the honest answer rather than the reassuring one. "People who are better positioned than me to answer that are working on it right now," she said. What happens to you tonight is that you stay here. Albright doesn't come near your room because Albright is currently occupied, and by morning the cardiac situation will be clearer. And Reith, the advisory panel? I don't know, she said. I know that Voss has the documentation and knows what it means and is not the kind of person who leaves things incomplete. Selby nodded slowly. He looked at his hands. I've been scared for so long, he said, not to her exactly, more to the room. I forgot what it felt like to not be. She didn't answer that because the honest response was that he wasn't clear of it yet and might not be for a while, and he knew that, and sometimes the right move was to let a person have the feeling they were having without correcting it. Her phone buzzed. She stepped outside the curtain. The message was from Voss, and it was 4 words. Come to the lobby. She walked through the corridor past the nursing station where Tanya was watching things with the attention of someone keeping a record, past the imaging bay where Dr. Wren's light was still on, and Garrett Hale's folding chair was still against the wall, through the ER's main artery, and out into the lobby. Voss was there. With him was Engel, and with Engel was a woman Olivia didn't recognize. Late 50s, short, the compressed, precise energy of someone who occupied rooms without needing to announce herself. She was in civilian clothes, but the lanyard she was wearing was not a hospital lanyard. It was a federal ID, and even across the lobby, Olivia could see the seal on it clearly enough to identify the issuing agency. Department of Defense, Inspector General's office. She hadn't been called. She was already here, which meant she'd already been coming, which meant this investigation had started not tonight, not when the trucks pulled in from Fort Caraway, but earlier, days or weeks earlier. And tonight was not the beginning of something but the convergence of several things that had been moving toward each other for longer than anyone in this hospital had understood. Voss caught her eye across the lobby. He gave her a small nod, the confirmation kind. And then the woman from the IG's office turned to look at Olivia, a direct, evaluative look, the kind that filed things. And she said, at lobby crossing distance, in a voice that was quiet but entirely audible, I've been looking forward to meeting you. From the corridor behind Olivia, from the direction of the administrator's suite, came the sound of a door opening hard against its stop. And then Pruitt's voice, sharp and shaking in a way Olivia had never heard it. I want a lawyer, right now. I want a lawyer before I say another word. The sound of Pruitt's voice bounced off the lobby walls, and then the corridor absorbed it, and what was left in its wake was the particular quality of silence that follows something irreversible. The woman from the IG's office. She'd introduced herself as Deputy Inspector General Carla Mote, which was a name that apparently meant something to Voss because his posture had shifted fractionally when she'd said it, did not react to Pruitt's demand. She looked at it the way you look at weather, noted, categorized, incorporated into the existing picture. She'll have one, Mott said, to no one in particular. That's how this works. She turned back to Olivia. Walk with me, she said. They walked to the small waiting area off the lobby, the one with the hard plastic chairs and the mounted television someone had muted hours ago, where the captions were still running on a news broadcast that had nothing to do with anything happening inside this building. Mott sat. Olivia sat across from her. Voss remained standing by the entrance to the area, close enough that he was part of the conversation, far enough that it was clear whose conversation it was. I want to be transparent with you about the timeline, Mott said. She had a directness that wasn't aggression, more like someone who had decided years ago that managing information was more expensive than providing it. My office opened a preliminary inquiry into Dunmore Logistics 4 months ago. Not the vest specifications specifically. That came later. We started with a procurement anomaly that a contract auditor flagged. The numbers were too clean in ways that numbers are only too clean when someone's managing them. Cole, Olivia said. Cole was one of 3 administrative contacts who had consistent access to the relevant documentation at the point where it should have triggered automatic review and didn't. Mott's hands were folded in her lap, still. When Sergeant Hale's formal complaint landed in our system 2 weeks ago, through a back channel, not the official route, because the official route had been managed, we accelerated. Tonight was not an accident of timing. We were 24 hours from a coordinated approach when the truck incident happened and compressed the window. So you came early. We came when the situation changed. She looked at Olivia steadily. which is where you enter the picture, not peripherally. Olivia waited. Your termination tonight, Mott said, will be part of the administrative record of this inquiry. Cole's decision to remove you from the building at the specific moment he did, while Hale was present, while Selby was incoming, while my office was moving. That's not going to be read as a routine policy enforcement. The timeline is too precise. He wanted me out of the room, Olivia said. He wanted a potential witness out of the room. Someone who might recognize what she was seeing. Mott paused. Someone who had military background and might make connections he didn't want made. A beat. Your service record is in our system, Marsh. It came up when we pulled the full picture of tonight. She sat with that. The record she'd left without ceremony, without a formal accounting of what it contained. Still sitting in a government database somewhere, apparently, as records did. What happens to Cole? She asked. Cole is currently at a property with documented ties to a Dunmore subsidiary, having left a hospital he was told to remain in during an active inquiry on the same night that two individuals employed by a Dunmore-connected security firm attempted to access a federal witness. Mott said it without inflection. He's going to have a complicated few months. And Reith, the advisory panel, suspended pending investigation as of 40 minutes ago, Mott said. The panel chair was briefed by my office. That appointment is going to be looked at very carefully, including how it was facilitated and who signed off. Olivia looked at the muted television. The caption was running some segment about a local wildlife story, something about elk in a state park. Completely disconnected from the room she was sitting in and the specific gravity of what was being dismantled in real time across multiple locations. Albright, she said. Cooperating, Mott said, with the dryness of someone who understood that cooperation that arrived only after containment was a particular kind of cooperation. He made 2 calls from the parking lot, one to the Dunmore security contact, one to Cole. We have both. She unfolded her hands. He's going to face consequences for what he did tonight. The degree will depend on the full scope of his involvement, which we don't have yet. There was a sound from the far corridor. Not alarming, just movement. Voss's people doing the ongoing work of a situation that was still active in several directions. The hospital itself was still running underneath all of this because hospitals didn't stop. Patients didn't pause their cardiac events or their fractures or their difficult nights for institutional crises. And the nursing staff had been doing their jobs through all of it with the specific resilience of people who had simply decided to keep going. Tanya was still at the station. She would be there until 7 a.m. That was just true. What do you need from me? Olivia asked. A formal statement, which we'll schedule properly. Not tonight. Tonight you've done enough. Mott's voice shifted fractionally, the professional layer settling into something with a little more texture. I've read the account of what happened in that lobby at 9:40. The dog, the handler, the decision you made when you understood what it would cost you. She paused. I want you to know that the people who made that decision to terminate you in that moment for that reason are not going to be able to frame it as a policy matter, not after tonight. The context is too clear. Olivia didn't say anything for a moment. I didn't do it to be in the right, she said. I did it because the dog was in pain. I know that, Mott said. That's exactly why it matters. She stood. Mott stood. They shook hands, brief, firm, the handshake of people who understood each other's utility in a situation and didn't need to perform warmth they hadn't established. Voss walked with Olivia back into the main lobby. Cole is in custody, he said quietly as they walked. Sheriff's department went in 20 minutes ago. He was on his phone when they arrived, apparently trying to reach someone at Dunmore Corporate who had already stopped taking his calls. She thought about that. The specific loneliness of the moment when the network you depended on realizes you're the liability and goes quiet. She didn't feel sorry for him. She also didn't feel the satisfaction she might have expected. She mostly felt tired in the thorough, bone-deep way of someone who had been awake for a very long time doing difficult things, and the tiredness was at least honest. How's Bravo? She asked. Stable. Wren's satisfied with the reduction. He's going to need 4 to 6 weeks of restricted activity and a follow-up scan, but the prognosis is good. A pause. Hale is with him. He hasn't moved from that room. I know. She went to the imaging bay. Not because Voss asked her to or because there was anything clinical she needed to manage. Wren had everything handled, competently and completely, but because she wanted to, which was a simpler reason than most of the reasons she'd acted tonight. Garrett was in the folding chair. He looked up when she came in. Bravo was sedated on the transport tray, his chest moving with the slow, deep rhythm of an animal in properly managed, unconscious rest. He looked less diminished than she'd expected. The size of him was still evident even in stillness, the structure of a dog built for serious work. "Mott talked to you?" Garrett said. "Yes. She's been building this for a while." "She said." He rubbed the back of his neck with his right hand. He was exhausted. She could see it now in a way that the earlier adrenaline of the situation had partly obscured. The kind of exhausted that accumulated over not just one night, but over months of sustained effort against institutional resistance. "I've been trying to get this in front of someone who couldn't be managed for 6 months," he said. "Every time I thought I had a channel, it closed. Cole was the worst of it. I almost believed him for about 3 weeks. Almost." "What stopped you?" "He knew things about my documentation that I hadn't told him," Garrett said. "Small things. Specific things. The kind of detail you only have if someone's been reading your files or listening to your calls." He looked at Bravo. "I pulled back, started moving differently, but I was too slow." He looked at his prosthetic hand for a moment. Not with bitterness, just acknowledgement. "The truck was new. They hadn't tried anything like that before. That told me we were close." "You were close," she said. "Bravo got us over the line," he said. "If he hadn't gone down, I wouldn't have come here tonight. I was going to the meeting with Cole, deliver the copies, and walk out. Bravo going down changed the direction." He paused. "You changed the direction." She was quiet. "You're the reason any of this happened in a single place tonight," he said. "The IG's office already had the pieces, but they were spread out. Selby was in his apartment scared to move. My documentation was in my bag. Cole was managing the timeline. You put yourself in the middle of a situation that pulled all of it into one building, one night." "I put myself in the middle of a dog that needed help," she said. "Yeah," he said. "I know." He looked at her directly. "That's the same thing." She didn't have an answer for that. She sat on the floor beside the transport tray. There wasn't another chair. And for a few minutes, she and Garrett Hale sat in the imaging bay of Hargrove Regional Medical Center in Dellwood, Wyoming, at somewhere past 1 in the morning, while a sedated military working dog breathed steadily between them and the rest of the building worked through its complicated night. It was not peaceful exactly, but it was as close as the night had come. Her phone buzzed. She looked at it. Unknown number. Not the Wyoming area code of Hartwell's earlier call. A Virginia area code. She answered. Marsh, a male voice, older, the flat institutional precision of someone who had spent decades in environments where voice conveyed rank without announcing it. "I'm calling from the office of the Army Surgeon General. We've been briefed on tonight's events." A pause. "I need to ask you something directly, and I need a direct answer." "All right," she said. "Your voluntary separation 3 years ago," he said. "The agreement that accompanied it. You signed a standard re-engagement restriction as part of that agreement. Are you aware of that clause?" She was aware of it. She had been aware of it every day for 3 years in the specific way that people were aware of things that defined the shape of their lives without being the thing they talked about. The clause had been standard, a function of the circumstances of her separation, the nature of the work she'd been attached to, the protocols around personnel who had operated in certain environments. She had signed it. She had understood it. "Yes," she said. "That clause," the voice said, "is under review as of approximately 40 minutes ago, at the request of Colonel Voss and with the preliminary support of the Deputy Inspector General's office." A pause that was not casual. "The review is not perfunctory. It's substantive. And the reason I'm calling you at 1 in the morning rather than sending a formal communication in 72 hours is that someone in this office wanted you to know before the morning briefing cycle, because the morning briefing cycle is going to include your name in a context you should be prepared for." She stood up. Garrett was watching her face. "What context?" she said. "Sergeant Hale's complaint," the voice said. is going to become the center of a formal investigation that will likely take 18 months and result in criminal referrals against multiple individuals, including at least one current government advisor. The documentation is substantial, the pattern is clear, and the investigation is going to need a clinical liaison, someone with military working dog medical knowledge, combat medic background, and experience working inside civilian medical institutions, to serve in an advisory capacity during the evidence-building phase. She was very still. "We're not offering you your old role," the voice said. "We're offering you something that doesn't currently exist because tonight demonstrated that it should exist. A formal position, full credentials restored, civilian contract status if you prefer it." Another pause. "Voss says you'll say you were just helping a dog." "I was," she said. "He said you'd say that too." She could hear something in the voice that was not quite humor but was in that direction. "The position exists whether you take it or not, Marsh. But the person we'd want in it is the person who walked back into a building she'd just been thrown out of because she hadn't finished the job." A pause. "Think about it. We'll talk formally in 48 hours. The call ended. She stood with the phone in her hand. Garrett was still watching her. He'd heard enough of her side of the conversation to understand the shape of it, if not the content. He didn't ask. He waited, the way people waited who had learned that patience in uncertain moments was not passive, but active. A choice, repeated. She looked at Bravo's steady breathing. She thought about the plant in her apartment that she kept forgetting to water. She thought about the cracked grip pen in her pocket. She thought about a dog on a lobby floor who had touched her hand with his nose and decided she was someone worth trusting, and everything that had followed from that single small moment of animal judgment. She was about to say something to Garrett, she wasn't sure what, when the imaging bay door opened and Dr. Wren leaned in with the expression of someone who had been awake too long and had found something in the data that was going to make the night longer. "I need you both," Wren said. "The contrast results just came back on the soft tissue scan." She paused. "There's something in the flank that I want a second set of eyes on. Old scarring, looks like. But the density pattern is unusual." Garrett was on his feet immediately. Wren looked at the imaging on the wall display, and Olivia came to stand beside her. And what she saw in the scan, the faint, irregular shadows in the left flank tissue, the pattern of old disruption in the muscle architecture, the small bright point that was not bone and not tissue, but something that did not belong, made her go completely still. Not healed shrapnel. Something else. Something smaller, more regular. Something with a shape that she recognized from a context she had not expected to encounter tonight, in a civilian hospital, in a military working dog who had been cleared for service. She looked at Wren. "That's not from combat," she said. Wren's face confirmed it. "No," she said, "it's not." Garrett was at the imaging display in 2 steps. Wren pointed without touching the screen, the precise, non-contact gesture of someone who had learned to indicate without contaminating. "There. And there. The density is wrong for scar tissue and wrong for retained fragment. The shape has too much regularity." Olivia leaned in. The object was small. 4, maybe 5 millimeters, and it sat in the left flank musculature at a depth that would have required deliberate placement rather than impact penetration. Shrapnel moved in chaotic vectors. It punched, it tumbled, it left the jagged, irregular traces of violence in soft tissue. This was none of those things. This was smooth-bordered and precisely positioned, the imaging signature of something that had been put there rather than driven there. "A tracker," Garrett said. His voice was flat in a way that wasn't calm. It was the flatness of someone absorbing information that rearranged everything they thought they knew about a sequence of events. "I can't confirm that without extraction," Wren said, "but the profile is consistent with a subcutaneous tracking device, passive RFID or low-frequency GPS, depending on the manufacturer." Garrett turned away from the display. He put his right hand against the wall and stood there for a moment with his back to both of them. She could see his shoulders working through something, the specific physical process of a person keeping themselves together while their understanding of what had happened to them was being revised in real time. "They always knew where he was," he said. "Not a question. If it's a tracker," Olivia said carefully, "then whoever placed it had access to Bravo outside of your presence, and they had the equipment to do it without leaving visible evidence." When was he last in a facility without me? Garrett turned back. His jaw was tight, but his eyes were clear. The particular clarity of someone who has decided that the most useful thing they can do with what they're feeling is set it aside for later. 8 weeks ago. Routine veterinary clearance at the base clinic at Caraway. I waited outside. Standard procedure for the physical. Handlers don't go in for the exam portion. Wren was already on her phone. I'm calling Voss, she said, and stepped out. Olivia stood with Garrett in the imaging bay, and the silence between them was the kind that didn't need to be filled. Bravo breathed on the transport tray. The display still showed the scan, the neat, terrible small shape in the flank that explained how a vehicle had known exactly where to intercept a truck on a dark road at exactly the right moment. Not surveillance, not leaked information from a compromised meeting. A signal, precise and continuous, broadcasting Bravo's location every time Garrett took him anywhere. The base clinic at Caraway, she said. Who runs it? Contract staff, Garrett said. He said it with the specific exhaustion of someone who had just understood something they were going to have to spend a long time being angry about. Civilian veterinary contractors. 4 of them rotate through. A pause. I never thought. He's a military working dog. The facility is on base, I assumed. You assumed the perimeter meant something, she said. Yeah, it usually does. Not when the people inside it are the problem. But Voss came in 90 seconds after Wren's call, which meant he'd been close, which meant he'd been managing the building's situation from a position that kept him accessible. He looked at the scan. He looked at it for a long time, longer than someone who was simply reading an image, the longer look of someone reading implications. Then he pulled out his radio and said 4 words into it. Lockdown Caraway Clinic. He lowered the radio. I need the names of the contractor staff, he said to Garrett. I can get them. Do it now. Garrett was on his phone in the corner, and Voss was back on his radio, and Wren was standing near the display with the expression of someone who had been a surgeon for 23 years and thought she had encountered most of the situations her profession could produce and had just discovered she was wrong. Olivia stood at the edge of it all and watched the machinery of consequence grind into motion. Slow, inevitable, the specific weight of institutions moving when they finally moved in the right direction. It took 40 minutes to confirm. The device was extracted by Wren under local anesthetic. Bravo was still sedated from the reduction procedure, which Wren said grimly was at least one thing that had worked out. And it was exactly what the scan had suggested. A passive GPS tracker, commercial grade but modified, the kind of modification that required technical knowledge and access to specific equipment. It was bagged, labeled, and in Voss's hands within the hour. The veterinary contractor whose name appeared on Bravo's exam record from 8 weeks ago was a man named Felix Orr. By the time Voss had the name, Orr had already been flagged in a separate database. Not military, not medical, financial. His personal accounts showed 3 wire transfers from a shell company that traced, through the same 3-layer structure as Albright's contact, back to Dunmore Logistics. This information reached Olivia in pieces, through Devereaux, who had taken on the informal role of keeping her informed in the way that people sometimes designated a particular person to manage information flow when the situation was too fragmented for everyone to track everything. She received each piece with the same response: a nod, a question when she had one, silence when she didn't. At 3:15 in the morning, Douglas Cole was formally arrested at the Dunmore property by county sheriff's deputies coordinating with federal agents who had arrived from the Denver field office in the hours since Mott had made her calls. He had been in the property's main room with a laptop and a phone, and the specific expression, reported by the first deputy through the door, of a man who had spent 2 hours realizing that the people he'd expected to help him had decided he was no longer an asset worth protecting. Dunmore Logistics cut contact with Cole at approximately the same time the Dunmore General Counsel received a call from the IG's office. The General Counsel, according to sources Mott mentioned to Olivia in a brief corridor conversation at 3:40, had immediately indicated a willingness to cooperate with the investigation. Corporate entities, Mott said, with the practiced evenness of someone who had watched this happen many times, generally cooperated when the alternative was worse. The calculus wasn't moral, it was arithmetic. Paul Reith reached at his home in Northern Virginia at 4 a.m. Eastern Time, by 2 agents from the IG's office, declined to comment and requested counsel. His suspension from the advisory panel had already been processed, and the formal notification was on its way. The panel chair released a brief statement by 6 a.m. Eastern that described the suspension as precautionary pending review, which was the institutional language for "we knew nothing and are very concerned," in which everyone who had been awake in a Wyoming hospital all night read with the specific literacy of people who had seen how the institution actually worked. Dr. Albright was suspended from Hargrove Regional pending investigation at 4:30 a.m., the paperwork signed by Patricia Engel in the administrator's office, with the particular efficiency of someone who had been managing crises for long enough to know that the paperwork was the first step, and sentiment was not part of it. Karen Pruitt's situation was more complicated, which Olivia had expected. Pruitt had a lawyer by 2 a.m. The lawyer's first move was to establish that Pruitt had acted within her interpretation of hospital policy, which was technically accurate and also, in the context of the full picture, inadequate. Mote's office was looking at the pattern of Pruitt's decisions over the 6 weeks prior to tonight, the access logs, the meeting records, the specific sequence of choices that had kept certain complaints from reaching certain ears. Whether Pruitt had knowingly participated in Cole's network or had been managed without fully understanding it was a question that was going to take longer to answer than one night. What was not a question was that her decisions had contributed to a situation in which a documented whistleblower had been placed in danger and a decorated veteran had been turned away from medical care. Engel communicated to Olivia, through the intermediary of a very tired HR administrator who appeared at 6 a.m. with a clipboard and an apologetic expression, that her termination had been formally rescinded. The language was institutional and correct and contained the word regret 3 times, which was 2 more times than Olivia thought the situation warranted and 1 more time than she thought the institution actually felt. She signed the form that acknowledged the rescission. She did not sign anything that constituted a statement about her future employment intentions, because the form that asked for that had a line she left blank. The HR administrator noticed the blank line. "We'd need you to indicate your—" "I know," Olivia said. "I'll be in touch." The administrator took the clipboard and went. It was 6:17 a.m. The sun was coming up over the high country to the east, the specific thin gold of high-altitude dawn that didn't so much warm things as illuminate them with a light that had traveled a long way and arrived a little tired. It came through the windows of the ER lobby and made the whole room look briefly like something other than what it was. Tanya was still at the nursing station. She had been there all night, and she looked it. And she was also still doing her job with the specific competence that Olivia had watched all night without fully articulating to herself what she was watching. Tanya saw Olivia cross the lobby and gave her the same almost smile she'd given her hours ago, the one that was a complete communication without being a sentence. "Coffee's fresh," Tanya said. "I made it 10 minutes ago because I needed it, and there's too much for one person." Olivia poured a cup. It was better than the coffee from the night before, which had been mediocre. This was merely average. It was fine. She drank it standing at the station counter and didn't say anything for a moment. "You doing okay?" Tanya asked. Not the automatic version of the question, the real one. "I'm tired," Olivia said. That's an honest answer. It seemed like the right moment for one. Tanya looked at her with the direct, slightly worn attention of someone who had been a nurse for long enough to have a sophisticated read on people. "That thing you did last night," she said, "with the elastic bandage, without looking at anyone. You handed it to me." "I did," Tanya said. "I decided to in about 2 seconds. Fastest decision I made all night." She paused. "I want you to know I was watching the whole time. After you went outside before the military came. I was watching the door." She said it without drama, matter of fact. "I don't know what I would have done if it had gone different, but I was watching." Olivia looked at her. "Thank you," she said. It was not a large exchange, but it was a real one, and at 6:20 in the morning after the night they'd both had, real was the thing that mattered. At 7 a.m., Garrett Hale found her in the small courtyard beside the hospital entrance, where she'd gone for air and ended up sitting on a concrete bench that was cold through her scrubs and not caring. He came out with 2 paper cups of something from the cafeteria that had just opened, and he sat on the other end of the bench without asking if she wanted company. He handed her one of the cups. "Hot chocolate," he said. "I know it's not. I just thought coffee seemed wrong." She took it. It was slightly too sweet and made with powder, not real chocolate, and it was the right call. They sat. "Ren says he can travel in 2 days," Garrett said. "With the right transport setup. Caraway has a rehabilitation unit." He wrapped his right hand around his cup. "I'll stay with him." "Good." She also said, Ren, that whoever placed the tracker did it cleanly. No infection, no inflammatory response. Bravo never showed any signs. He said it was something in his voice that wasn't quite anger and wasn't quite grief and was probably both. 6 weeks of walking around with a targeting device in his side and he just kept doing his job. "That's what he was trained to do," she said. "Yeah." He looked at the parking lot, the morning light hitting the asphalt. "Felix Orr is in custody. They picked him up 2 hours ago. He was apparently trying to drive to New Mexico." A pause. "I keep thinking about the 8 weeks between the appointment and last night. All the times I took Bravo somewhere. The restaurant where they let him sit outside, the park near my sister's house." He stopped. "They always knew." "And now they don't," she said. He looked at her. The look had the weight of someone who wanted to say something and was figuring out whether to say the version he'd practiced or the actual version. He went with the actual version. "I don't know how to do what you did," he said. "Walk back into a building that just threw you out, like it wasn't a thing." "It was a thing," she said. "I just decided the other thing was bigger." "How do you know when it's bigger?" She thought about it. "You don't always," she said. "Sometimes you're wrong about what's bigger and you pay for it and you still don't regret it because you were working from what you knew at the time." She looked at the cup in her hands. "Last night I wasn't wrong, but I didn't know that when I walked back through the door." He was quiet for a moment. "What are you going to do?" he said. "The IG's office has a position," she said. "Advisory capacity? Clinical liaison for the investigation." She paused. "Voss thinks I should take it." "What do you think?" She thought about the blank line on the HR form, the plant she kept forgetting to water, the 3 years she'd spent in pale green scrubs in a building where nobody knew what she'd done or who she'd been, and the specific relief that it provided, and the specific cost it had also carried. The two of them inseparable, the way most things worth anything were inseparable from their cost. She thought about Bravo's nose touching her hand on the lobby floor, the moment of animal assessment and the decision that followed it. "I think," she said slowly, "that I spent 3 years being quiet about everything I knew how to do. And it was the right call at the time, but last night," she stopped. "Last night I used everything, all of it, and it mattered." She looked at the morning light. "I don't think I can go back to using none of it." Garrett nodded once. He understood that, she thought, in the specific way that people understood things they'd lived rather than been told. "Take the position," he said. "I haven't decided yet." "You have," he said. "You're just still talking yourself into it." She looked at him. He was right, which was slightly annoying and also fine. At 9 a.m., Patricia Engel held a brief internal meeting with senior nursing staff, department heads, and the 2 members of the board she'd managed to reach by phone during the night. Olivia was not at this meeting, but Tanya was, and Tanya reported it afterward with the economy of someone who knew how to extract the essential from the substantial. Engel had been direct. She'd laid out what had happened, not the sanitized version, not the version shaped by institutional self-protection, but the actual sequence of events, including Cole's role, Albright's contact, the termination of a nurse who had correctly identified a medical situation and responded to it. She'd said, according to Tanya, that the hospital's policies would be reviewed and revised by a team that included ER nursing staff, not just administration. That the emergency response protocol around veteran and military-adjacent cases specifically was going to be redesigned from scratch. That the people who had made the decisions they'd made last night were no longer in positions to make decisions of any kind at Hargrove Regional. She was brutal about it, Tanya said. Not emotional, just accurate, which was worse. For who? For the board members who'd approved Cole's last contract review, Tanya said. They looked like they'd eaten something bad. The public piece came later because these things always had a public piece, and the timing of it was not something Olivia controlled or tried to. A local news outlet had picked up the story from a county sheriff's department press release about Cole's arrest. By noon, it had been picked up by a regional wire. By 3 p.m., it had reached national outlets because the combination of elements — veteran, military working dog, procurement fraud, hospital dismissal, tracker — was the kind of story that moved fast once it had enough oxygen. The framing was imperfect, because it always was. Some outlets led with the dog, which was fine and probably accurate to what had drawn people to the story. Some led with the fraud, which was the harder, more important thing. One outlet ran a headline that was factually correct, but missed every nuance of what had actually happened in favor of a cleaner narrative arc. She read it and put her phone down and didn't read any more headlines. What mattered was the documentation. Selby's files, Hale's records, Wren's extraction report, the tracker in its evidence bag, the financial trails Mott's office had been building for 4 months. All of it was now part of a formal federal investigation that had enough structure to survive the news cycle and enough substance to produce the kind of consequences that didn't evaporate when the cameras moved on. Cole was charged. Orr was charged. Albright was suspended pending further action. Reith's advisory panel appointment was formally terminated, and his name was submitted to the DOJ's Public Integrity section for review. Dunmore Logistics government contracts were frozen pending audit. All of them, across all programs, not just the working dog equipment line. The specific contract that had produced the substandard vests was referred for criminal investigation on 14 separate counts. None of it happened overnight. None of it resolved in a single clean moment. Investigations took months. Courts took longer. The apparatus of accountability moved the way large things moved, with significant inertia, imperfect aim, and occasional frustrating pauses where nothing seemed to be happening, and then suddenly a great deal happened at once. But it moved. That was the thing. That was what she held on to in the weeks that followed, when she was tired or uncertain, or sitting in a deposition room in a federal building answering questions about the specific sequence of a specific night for people who needed the details in a form they could use. It moved. The system was slow and imperfect and required someone to put themselves in its path and refuse to move before it would shift direction. But when it shifted, the shift was real. She took the position. The formal offer came through proper channels 6 days after the night at Hargrove Regional, in a document that used language she recognized from her service years: precise, unambiguous, outlining scope and authority, and the specific protections that came with official capacity. She read it twice. She signed it. She sent it back the same day. She called Hartwell and told her. Hartwell said, "Good." Then, after a pause that contained something Hartwell rarely allowed into her voice, "I always thought the separation was the wrong call." "It wasn't wrong for what I needed at the time," Olivia said. "No," Hartwell said, "but time changes what you need." Another pause. "You should know that the people who signed off on the clause review did it unanimously. That doesn't usually happen." "I know," Olivia said. "I read the memo." "Of course you did." There was something in Hartwell's voice now that was unambiguous. Not quite pride, because Hartwell was not the kind of person who performed pride, but the specific warmth of someone who has invested in a person for a long time and watched that person prove the investment correct. "Take care of yourself, Marsh." "I'll try," she said. "I'm still not great at it." "Nobody is," Hartwell said. "Do it anyway." Bravo left Hargrove Regional 2 days after the night that had brought him there, in the proper transport setup that Voss's people had arranged, with Garrett beside him the whole length of the drive to Caraway. Wren had cleared the transfer with the specific confidence of a surgeon who had done good work and knew it. Olivia stood in the hospital's ambulance bay when they loaded the transport. Garrett paused before he got in. He looked at her across the 6 feet of Wyoming morning air between them. "When the investigation phases into the trial prep stage," he said, "they're going to want testimony about the clinic, about what was found and when and how." "I know," she said. "I'll be there." "I know you will," he said. It was not a compliment exactly. It was an acknowledgement of what she was, what she'd demonstrated, what he'd seen in her when she'd crouched 4 feet from a 110-pound dog in a lobby and waited without moving. He got in. The transport pulled out. She watched it go until it cleared the curve of the entrance road and was gone. She stood in the ambulance bay for a moment in the cold and the quiet and let herself exist in the specific space of after, not aftermath, which implied something finished, but after, which was the ongoing condition of having come through something and still being here on the other side of it. It was not triumphant. It didn't feel the way the movies suggested it should feel. It felt like cold air and tired legs and a shoulder that still ached at the joint where she'd taken impact. And underneath all of that, a quieter thing, harder to name, the satisfaction that wasn't about winning, but about having been exactly what the moment needed, when the moment needed it. She'd walked back through those automatic doors with no badge and no plan, and nothing except the certainty that the job wasn't done. That was the whole story. Everything else was what happened because of that single decision, and the decision hadn't been complicated. It had been the simplest thing she'd done in 3 years, simpler than the 10,000 small adjustments of a life spent being less than she was. A dog was in pain. She could help. The cost was real, and she paid it anyway. She was not a person who believed in clean lessons or tidy morals. She'd seen enough of the world's actual texture to know that most situations didn't resolve into clarity, that accountability arrived imperfectly and late, that the people who deserved consequences sometimes received them and sometimes didn't, and that you did your job anyway because the alternative wasn't neutrality. It was complicity in the gap between what was true and what was allowed to stand. But this one had resolved, not perfectly. The imperfections were documented in ongoing federal proceedings and would be for the next year at minimum, but substantially. In the ways that mattered, Cole would answer for what he'd done, Reith would answer, Orr would answer, Albright would answer. The organization that had provided substandard protection to working dogs, deployed in conditions that cost them everything, would answer, and the dogs that came after Bravo would be equipped with gear that did what gear was supposed to do. And maybe some of them would come home without injuries they shouldn't have had, and the people who brought them home would do so without a targeting device in their partner's flank, and none of that was small. She walked back inside. Tanya was at the station. She would be there for another hour until the day shift properly took over, and she looked like someone who had been awake for far too long and had also had a night that she would be processing for a while. "You heading out?" Tanya said. "Soon." "Before you do." Tanya reached under the counter and produced the borrowed pen, the stubby one with the cracked grip that Olivia had taken from the supply closet at the beginning of the shift that felt like a different era. "You left this." Olivia looked at it. She took it. "You can keep it," Tanya said. "It's a terrible pen. Nobody wants it, but it's yours now." She looked at the pen in her hand. Cracked grip, smudge of ink on the barrel, the kind of object that accumulated in places where people worked hard and didn't have time to manage small things. It was objectively worthless. "Thank you," she said. She meant it for more than the pen, and Tanya knew that, and neither of them needed to say so. She walked out through the automatic doors into the morning, and this time she didn't stop on the sidewalk. She walked to the parking structure and took the stairs, the right stairs, the ones that went up instead of the sub-basement. And she got in her car, and she sat there for a moment in the specific silence of a vehicle that isn't moving yet. The plant in her apartment needed water. She'd been forgetting to water it for 3 years. She was going to go home and water the plant and sleep for as long as she needed to. And when she woke up, she was going to start being, in a context where it was on record and where it mattered, exactly what she was. Not the rookie they'd dismissed, not the quiet background presence who made herself small enough to fit the space they'd allocated her. The person she'd been before she'd practiced being less, and more than that person. Because 3 years of civilian nursing had given her something the Army couldn't, the specific knowledge of how institutions failed the people inside them and how to stand in the gap anyway. She started the car. Outside, the Wyoming morning was clear and cold and indifferent to everything that had happened inside that building. The way mornings were. Not cruel in their indifference, just honest. The world didn't mark the moments that changed things. The sun came up on the same schedule regardless of what the night had contained. But the night had contained something, and it had left marks, and the marks were real. She pulled out of the parking structure and drove toward the morning.